Thank you for subscribing to this channel. This is a reading part C practice video.
Let's analyze the given paragraph to understand the cause of eating problems in advanced dementia and determine the correct answer. The paragraph discusses eating problems in advanced dementia and mentions that these problems may include various factors, such as oral dysphagia, pharyngeal dysphagia, inability to eat independently, and refusal. It also highlights that when these problems occur, acute causes, e.g., dental pathology, should be considered, and the reversal of such causes should be guided by the previously agreed goals of care. The paragraph provides a general overview of the possible causes and management of eating problems in advanced dementia. Now let's evaluate the options. A. Inappropriate eating practices. This option is not directly mentioned in the paragraph as a cause of eating problems. The paragraph primarily focuses on dysphagia, aspiration, inability to eat independently, and refusal. B. Recent dental procedures. This option is mentioned in the paragraph as an example of an acute cause that should be considered when eating problems occur. It is a valid consideration based on the paragraph. C. Aspiration of food. This option is mentioned in the paragraph as a risk associated with pharyngeal dysphagia. It is a valid cause mentioned in the paragraph. D. Refusal to eat independently. This option is mentioned in the paragraph as one of the eating problems that may occur in advanced dementia. It is a valid cause mentioned in the paragraph. Based on the analysis, option A, inappropriate eating practices, is not explicitly mentioned as a cause of eating problems in the paragraph. Option B, recent dental procedures, is mentioned in the paragraph as an acute cause that should be considered. Option C, aspiration of food, is mentioned in the paragraph as a risk associated with pharyngeal dysphagia. Option D, refusal to eat independently, is mentioned in the paragraph as one of the eating problems that may occur in advanced dementia. Given that options B, C, and D are all mentioned in the paragraph as valid causes or considerations for eating problems in advanced dementia, and option A is not mentioned, the correct answer is option A.
Let's look at the next question.
The correct answer is option B. Infections in people with advanced dementia should not always be treated. Let's analyze why the other options are incorrect. A. About 50% of people with advanced dementia will suffer from pneumonia during the last 2 weeks of their life. This statement is not directly supported by the passage. The passage states that approximately 50% of patients with advanced dementia are diagnosed with pneumonia in the last 2 weeks of life, which does not necessarily mean that 50% will suffer from pneumonia. The statement focuses on diagnosis, not on the inevitability of pneumonia in all cases. C. Within a 12-month period, approximately 2/3 of nursing home residents with advanced dementia are suspected to have an infection. This statement accurately represents the findings from the study of pathogen resistance and exposure to antimicrobials in dementia, spread, as mentioned in the passage. However, it's not what the author specifically suggests in the 7th paragraph. The focus of the 7th paragraph is on the implications of treating infections, not just the prevalence of infections. D. Urinary and respiratory infections are the most common clinical problem in advanced dementia. This statement is partially correct based on the passage, as it mentions that infections, specifically relating to the urinary or respiratory tract, are common clinical problems in patients with advanced dementia. However, the passage doesn't explicitly state that these infections are the absolute most common clinical problem. The statement may be overly strong based on the information provided in the passage. In contrast, option B aligns with the author's discussion of the use of antimicrobials in treating infections in advanced dementia patients. The passage raises concerns about treating infections in this population, given the potential increase in discomfort and the fact that such treatment may not align with the patient's preferences or goals of care. This aligns with option B, suggesting that infections should not always be treated, highlighting the need for a more nuanced approach to care in these cases. L.